I am Dr. Alba Azola, and together with Dr. Peter Rowe, we will be presenting at the Society meeting for Adolescent Medicine on demystifying long COVID, diagnosis and management of adolescents and young adults. And the reason why we wanted to bring this workshop is that long COVID is a very prevalent issue, and physicians are encountering these patients, but they don't have the knowledge for the clinical care that can really help them regain function. About 1.3% of the pediatric population has long COVID. This was an estimate from the CDC. The risk factors for this patient population include female sex and usually ages from 12 to 17-year-olds. During our presentation, we will be walking the clinicians through initial assessment, diagnosis, and management of these patients. Thank you.
Hi, I'm Dr. Peter Rowe. I've been the director of the Chronic Fatigue Clinic at the Johns Hopkins Children's Center for the last 30 years. And as Dr. Azola mentioned, we're going to bring you the approach that we've developed over that time to the issue of ME/CFS, or myalgic encephalomyelitis chronic fatigue syndrome, as this is really what many people with long COVID who have big impairments in function actually have. We have developed an approach that focuses primarily on orthostatic intolerance, but also looks at other risk factors like joint hypermobility, postural dysfunctions, and a variety of allergic problems, including mast cell activation syndrome. So we're in this workshop, we'll walk people through how we approach those problems, give them some tools to manage patients that they see in their clinic with who meet the criteria, and provide some resources for further reading. We'll be doing this as an interactive problem-solving session at the end of the workshop to really cement the ideas. So we're looking forward to helping our colleagues understand the approach that we've been taking to long COVID, which I think will apply to many of their other patients as well. So thank you very much.